to subcommittee. Senator Crawford, if you'd like to present Senate Bill 336.
Thank you, Madam Chair. Thank you also for letting me go first, as I have a couple of people in gubernatorial appointments too, so I'm going to be double teaming today.
We'll try to make it fast for you.
Thank you. Senate Bill 330, well, for the record, Sandy Crawford, District 28. Thanks for the opportunity to be here today to present Senate Bill 336. Under current law, licensed residential care facilities are eligible for a $156 a month supplement for home care in those facilities. This bill removes the cap and allows the funds to allows more funds to be drawn down from the feds, and this would also be subject to appropriations. But this will allow our facilities to potentially draw down more funds. They're kind of restricted at the $156 cap. I'm happy to answer questions, but I think I have a witness behind me that can probably tell a little bit more about it.
Thank you, Senator. Any questions for the senator on the bill? Seeing none.
Thank you.
First in favor, please come forward. A very hesitant Senate Bill 336. Those in favor?
Hi, Katie Gamble here on behalf of Jorgen Schlemeyer for the moment. On behalf of one of our clients in support of the bill. I don't know which one, and Jorgen's not responding to my messages.
I appreciate your candor, and we will make sure that your witness
but I
form is
don't
fully
want,
completed
but
after,
I will fill it out completely, and I can touch base with all the committee members
before the end of the hearing.
I was just stuck sitting here. So
That sounds great.
Okay.
We'll not make you go through questions. Thank you.
Thank you.
Anyone else on the record in support of 336? Thank you, Mr. Winton. Is there anyone else here to testify in opposition to 336? Seeing none. Anyone here for informational purposes only? Senator Crawford, do you have any concluding remarks to this
Maybe I
robust
will,
hearing?
since I thought I was going to have a little more backup than that. It's my understanding that they have identified some federal funds that they are able to draw down, but this the current statutes prohibit them from doing so. So this would allow them to draw down funds.
Some basic questions. Is this the 156?
The $156 cap,
cap
the
monthly.
cap is what's keeping them from drawing down the funds, but it will still be subject to appropriations.
I see. So that's not state money?
No, this is my understanding. We had this bill last year. It's my understanding it's going to allow them to draw down some federal funds, but the cap is prohibiting it.
Because we've said we can't do more than
Correct.
this amount.
Yes.
But it'll be a pass-through
Correct.
administered by the state.
It's still going to be subject to appropriations. Yes. So
makes
I
more
was
sense.
not going to give too many details. I thought I was going to get some backup, but that's my understanding.
No problem. Thanks so much. Anybody have any further questions? Okay. Thank you, Senator.
Thank you.
This concludes our hearing on Senate Bill 336. Senate Bill. Senator Fitzwater, I'm sorry, I didn't see you hiding behind the chair. If you'd like to present Senate Bill 538, please proceed when ready. At least we didn't keep you waiting as long
Oh,
today
my
as
word.
we did yesterday in the House.
Yeah, I'm glad I don't have to go behind one of your bills again. That's always super fun, especially in the House, a very inquisitive House committee. Travis Fitzwater, Senator from the 10th District on Senate Bill 538. This bill's pretty simple, even though it's very long. It just clarifies language. It removes a statute that is outdated from 2009. It removes mental health coordinators, which we've basically removed from any state level control or up to this point. So we don't call them that anymore. So we're just removing that to remove liability and put the liability back in place where it should be, which is the behavioral health liaisons, which we're adding under section 632.440. I filed this on behalf of the department. They're here to testify and give you a little bit more background on it, but it's basically cleanup language that clarifies our laws and liability.
It looks like there's also a change in timeline.
Yeah, the department would have to testify on that piece.
Okay, great. Any questions for the senator? Seeing none, first witness in favor.
Good morning, Madam Chair and members of the committee. My name is Nora Bach, and I'm the Director of the Division of Behavioral Health at the Department of Mental Health. And Senator Fitzwater did explain this really well. We used to have positions in the department that were called mental health coordinators. They don't exist, and there is not a direct equivalent. So we're removing that language. It has, though, been an ongoing source of confusion. So that's why we're really trying to act on it rather than just leave it be. So we want to do the cleanup. We are adding behavioral health liaisons to Section 632-440 to clarify, as the senator indicated, that these particular positions, which are relatively new, are intended to be covered by the liability protection. And if you have any questions, I'm here to do that, but I'm in support of the bill.
Can you touch on the 48-hour response time instead of 4 days? Is that going to be problematic for the department to respond
No.
to?
No, it will
Okay,
not.
great. Any other questions for this witness? Okay, thank you so much for your
Thanks.
testimony. Anyone else here in support? Seeing none, anyone here in opposition? Is anyone here for informational purposes only? Seeing none, Senator, do you have any concluding remarks? Thank you so much. This concludes our hearing on Senate Bill 538. Senator Gannon, would you like to present Senate Bill 419 to the committee? Thank you, Senator, whenever you're ready.
Good morning, Chairwoman, members of the committee. Thank you for the opportunity to present Senate Bill 419 dealing with patient boarding. For the record, I am Senator Elaine Gannon representing the 3rd District. Patient boarding refers to foster kids in the custody of the Department of Social Services and developmentally disabled persons in the custody of the Department of Mental Health who sometimes remain in hospitals after they are medically ready for discharge. This occurs because there are no available post-discharge placements. Abandoning these vulnerable persons in hospitals is harmful to them and costly to the hospital and to the state. The legislation requires the Department of Social Services and Mental Health to oversee and implement a project to assess the incidence and implications of foster children and developmentally disabled persons who are hospitalized without medical justification because appropriate post-discharge placement options are unavailable or that the patients are awaiting screening for appropriate residential services. The departments are required to make recommendations to ensure that treatment is in the most cost-effective settings consistent with their behavioral health conditions and federal and state standards for treatment in the least restrictive environment. The legislation requires the department to issue interim reports in 2023 and 24 and a final report in 25. The departments are required to collaborate with stakeholders in developing reports and recommendations required by the legislation. Since the filing of similar legislation last year, the interested stakeholders have been working together to address this problem. I've been happy to be able to participate in those discussions. I appreciate this progress, and my goal with filing the legislation this year is for it to continue. Thank you.
Thank you. Are any questions for Senator Gannon? Seeing none, anyone here to testify in support of Senate Bill 419?
Good morning. My name's Brian Kincaid. I'm Vice President of Children's Health and Medicaid Advocacy for the Missouri Hospital Association. I'm a registered lobbyist here to speak in favor of Senate Bill 419. Senator Gannon's being rather modest. The work she's done already to raise awareness of this issue and to call the parties that have interest in the care of these children together and to begin productive work has been remarkable. A group of probably 10 or 15 of us that has now probably grown to 15 or 20 and grows
More continues
every
to
month is beginning to really coalesce around some of the core issues that are causing the problems of boarding in our state. It's really important to know that I think we all feel that this isn't a particular failure of any one actor who have responsibilities for these kids. Combination of just a general growing need for children's mental health services over the past decade, exacerbated by the pandemic, has really overwhelmed this system. And I'm really encouraged that the group that Senator Gannon has called together and is encouraging with her legislation will bring forward some important and needed reformations and improvement to our system for children's mental health care in this state. And her legislation is doing a very important role in just elevating the awareness of that, not only among the folks who are involved in encouraging us to work together towards good solutions, but raising awareness in the legislature, because eventually there will be changes in law, policy, and appropriations that are needed to support the recommendations that come out of this work. 60 to 100 kids any day in this state are boarded in our hospitals, and of course we know that's a terrible place for them to be, but for the alternatives of being in a very unsafe setting. So it's important work. We're pleased to be a part of it, and we're pleased to be partners with the Departments of Social Services, Mental Health, the residential treatment agencies, the community mental health centers, a very wide body of experts called together by the Senator to work on this important issue. Be glad to answer any questions.
Thank you. Yes, Senator Arthur.
I may be overthinking this, but among the parties, it includes the term consumers. Do you know what's intended by that?
Parents, foster parents,
Okay.
folks who have responsibility, direct care responsibilities
Okay.
for the children who use these services, I think, are important inputs into what they need. What we're going to find is so much of the care we're delivering today is in institutions it's at higher levels, and that's not necessarily the best outcomes for kids. So, I think you'd probably hear from most of our hospital colleagues that their desire out of this isn't to see more hospitalization, but frankly, more services in the community, more services in the home, in schools. That's where kids will do best with this and keep them from elevating.
Of
So the
course, and I
parents are an
couldn't
important element.
agree more. I'm just wondering, is that a commonly understood term, or is that defined somewhere?
That, I understand it, but I couldn't speak to the commonality of that phrase
Okay.
in the industry.
Okay, thank you.
Thank you so much. Anyone else in favor?
Thank you, Madam Chair. Members of the committee, Justin Alferman representing SSM Health. We would like to go on record in support of this legislation. I want to thank Senator Gannon for pulling together this large coalition that we've been part of for the past year, almost 2 years. It really speaks to the need that we have in the state of Missouri. And just to put it in perspective, SSM Health has 9 hospitals in the state of Missouri. We currently have 8 children who are being boarded for a total of 694 bed days, and 16 adults for a total of 3,337 days already this year, and we're just now into April. Last year, we had over 81 children for a total of 4,319 days and 115 adults for 7,590 days. The need for placement in a residential setting for these patients and getting them out of the acute care facilities is imperative. The I will say that having worked in government for the last 15 years, I have never seen the level of coordination between providers and social services, health, and mental health like we are seeing in this past year. It's been absolutely fantastic. But we need to get to the root of this problem and figure out our residential facility problem in the state of Missouri. Happy to answer any questions.
I have a brief question just about the impact of Families First nationally and how that's impacting the lack of treatment facilities for kids. And so just wanted to say, as you're working through the center, Gannon, if you wouldn't mind sharing with me what you're learning on that front, because I think it's complicating the issue. So I was going to ask you a question. I realized that was really more of a statement. So thanks. You're off the hook. Next witness in support.
Thank you.
Morning, Madam Chair, members of the committee. My name is Mary Chant. I'm the director of the Missouri Coalition for Children, and I'd like to thank Senator Gannon for bringing forward Senate Bill 419. Missouri Coalition for Children has been participating in this coalition for over the last year, and I just want to highlight a couple of things. Both Mr. Kincaid and Mr. Alferman went over much of the material, but I think it's important also to acknowledge that that over 60% of the children who come into the child welfare system come in for reasons of neglect. Frequently, that's because of unintended needs of behavioral health, either for the child or the family. And that we are looking at a service continuum in which child welfare can become sort of the default agency when families are in distress. And so what we have is we have children coming into a system not designed to address some of the behavioral health challenges that they have, but is addressed primarily to address child welfare. And that by expanding this and being able to better respond to children and families in crisis, and I think the important part is even as we address the immediate crisis is to continue to look moving things upstream. Rarely does somebody start at the point of being 16 and being, violent against property in a home where there's an emergency intervention needed. So even as we look to stabilize those services and resources that are available right now, I ask us to keep moving things upstream so that we can provide better and more comprehensive services to families earlier in the process. Mr. Alferman mentioned that that we need to be able to step children and youth down to residential treatment facilities. I can tell you that the number of high acuity residential treatment center beds from 2019 to 2022 was reduced by approximately 48%, and that's the availability of open functional beds. That is in part due to the success of being able to serve children more effectively in community-based settings, but that is also in large part due to workforce issues and the inability to really fund those residential treatment services to the level that they are needed in order to serve these children. But clearly, every point of the continuum, we have children who are, whether it is in community-based counseling, whether it's in residential treatment, whether it's in intensive outpatient, whether it's in emergency room, at every point of the continuum, we have children who need to be both stepped up and stepped down, and those transition resources are not available or in supply.
Thank you for your testimony. Are there any questions for this witness? Thank you. Next testimony and support.
Madam Chair, David Winton here on behalf of BJC Healthcare and Cox Health. There's two hospital systems that have a number of these kids boarding with us as well as adults in a similar situation. We want to go on record in support of the bill, express our appreciation to the sponsor, Senator Gannon, and the committee for taking time on this.
Any questions for the witness? Thank you.
Thank you.
Anyone else in support of Senate Bill 419? Is there anyone here in opposition to Senate Bill 419? Anyone for informational purposes only? Seeing none, that concludes the hearing on Senate Bill 419, unless Senator Gannon has any closing remarks.
Thank you for hearing the bill.
Senator Gannon, would you like to start with presenting on Senate Bill 420?
Yes, ma'am. Again, thank you for the opportunity to present Senate Bill 420 dealing with rural emergency hospitals. In 2020, Congress passed legislation allowing rural hospitals starting this year that have 50 beds or less to be designated as rural emergency hospitals. Hospitals designated as rural emergency hospitals receive a monthly fee and enhanced Medicare payments for providing outpatient services, but do not provide inpatient services. Rural emergency hospitals allow rural residents in areas unable to sustain a full-service hospital to obtain needed outpatient medical services. Rural disparities in health care are a challenge. Rural residents are more likely than urban residents to die prematurely from the 5 leading causes of death: heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. Rural counties have fewer healthcare workers, specialists, critical care units, emergency facilities, and transportation options. Rural residents are also more likely to be uninsured and to live further away from healthcare services. Rural hospitals are critical to providing needed services to Missourians, but unfortunately, in the past decade, 10 rural Missouri hospitals have closed. Many others operate at a loss. The impact of a hospital closing on the local community is devastating. According to the National Advisory Committee on Rural Health and Human Services, closing a rural hospital causes a higher death rate in the community, resulting in residents traveling longer distances to obtain medical care and harms the local economy. At least 8 states, including 5 neighboring states, Arkansas, Illinois, Iowa, Kansas, and Nebraska, have passed rural emergency hospital enabling legislation. Thank you again for this opportunity.
Thank you, Senator Gannon. Are there any questions? Seeing none, is anyone here in support?
Madam Chair, members of the committee, Rob Monses with Missouri Hospital Association. We greatly appreciate the time of the committee and appreciate Senator Gannon for bringing this forward. I think this was compelled by some interest on the part of one of the hospitals in her area interested in the rural emergency hospital designation. Typically, the hospital has to be a critical access hospital in order to seek this designation. Not all hospitals will be interested in that. It is going to be on a case-by-case basis as to whether the reimbursement mechanics are better for them under this new status. But as she said, this is enabling legislation that would allow hospitals in Missouri that opportunity. And there certainly could be a number of hospitals that would benefit from this. So we appreciate the committee's time, and we hope that Missouri would soon be joining those 8 other states that have approved this enabling legislation.
Thank you. Are there any questions, Senator Arthur?
I read about this in an article a few months ago, actually, so I'm happy to see the legislation. Is there any evidence to believe that this will help any of the closed hospitals in rural areas?
That's a good question. You know, we were given a presentation back in the fall. We do a rural advocacy trip to Washington, D.C. each fall. And I know that you're required to have that critical access hospital designation I mentioned earlier. It's unclear to me if a hospital has already closed. There's timelines involved with how I believe it's up to a year after they've been closed that all of the licensure and other requirements are still in place for them to move forward. So I think it's possible that it could help some of those. The reality of it is in rural parts of America, rural parts of our state, the economics of running a hospital are very complicated. The pyramid just doesn't work. And so I don't know for sure, Senator.
Okay,
It's a good question, though.
That's fair. Is there a companion House bill
There is. It was actually heard in general laws this morning. Representative Henderson from Senator Gannon's district is the sponsor of that, and so it's flip chambers. It's on the consent over there. Excuse me. That bill is a consent bill. There hasn't been any known opposition, no cost.
Okay, great. Thank you. Appreciate it.
Thank you.
Thank you.
Anyone else in support?
Madam Chair, David Wenton here on behalf of BJC Healthcare. I want to go on record in support of the legislation. Appreciate the sponsor for bringing it forward to you all in your consideration. We have one of the hospitals that we believe this will really help ensure the viability of that hospital. Happens to be in Senator Gannon's district, and hope this helps other hospitals as well.
Any questions for this witness? Thank you.
Thank you.
Good morning again. Katie Gamble here on behalf of the Missouri College of Emergency Room Physicians. Just want to go on record in support of the legislation and increasing access for those in the rural parts of our state.
Any questions? Thank you. Anyone else in support? Seeing none, is there anyone here in opposition? Anyone for informational purposes only? Senator Gannon, do you have any concluding remarks?
Thank you.
Thank you. That concludes the hearing on Senate Bill 420. Senator Moon, before you leave, would we like to call the roll?
Senators Coleman. Here. Arthur. Here. Gannon. Here. Moon. Here. Thompson Raider. Washington. Here.
Thank you. We have a quorum having been established. Senator Arthur, would you chair the committee while I present my bill? Oh, I'm sorry, Senator Washington, please go to 443. I lost track of where we were on the agenda. Senator Washington, please proceed.
Good morning. Thank you for allowing me to present. This is Senate Bill 443. Basically, what this bill does is prevents any family court from allowing a parent who's on who has a medical marijuana card from seeing their child. Be the same as if someone and now the rules of the law has changed, so marijuana is actually legal, so there's no real valid reason for the usage of marijuana to prevent visitation when a child is in family court proceedings.
Senator, is this limited only to those who have a medical card, or is it to all legal users?
Well, when we
under the
filed it, it was
Constitution?
the law hadn't changed yet, so it was medical marijuana, but I'd be more than open to doing a substitute that would say marijuana total.
Okay, great. I just think if we're going to pick what legal activities we're prohibiting children from seeing their parents.
You said if we're going to pick up what?
I don't think we should limit what legal activities parents
Correct.
are able to engage in without receiving access to their children.
I agree.
Any other questions? Thank you, Senator, for bringing the bill.
Okay.
Is there, I'm sorry, did I interrupt you?
No.
Okay. Is there anyone here to testify in support?
Good morning. Tom Robbins from Moki and Trade. Very, very much in support of Senate Bill 443. At Moki and Trade, we represent about 85% of the licensed market, but our interest is also in the health and welfare of the patients for a properly functioning program. And both studies and my personal experience show that about 70% of people who use cannabis use it for sleep. And so it would be unfortunate to continue on in this system where people are using Xanax or Ambien, which a benzodiazepine or a hypnotic in order to induce sleep versus something far, entirely natural and non-toxic in cannabis. And so when going through a family law situation, having been a lawyer involved in that, it's a misery. And so bad habits can spin out of control, and I think it'd be better that they be engaging in a less toxic form of relief. So, thank you.
Is there anyone else here in support? Anyone here in opposition? Is there anyone here for informational purposes only? Seeing none, Senator Washington, do you have any concluding remarks?
Yeah, I think that a couple of the witnesses who've come the last couple of years weren't able to come, but they did send some testimony. So I hope that you got that, and if not, we'll get that to your office.
Thank you so much, Senator. This concludes the hearing on Senate Bill 443, and I'm going to pass the gavel to Senator Arthur.
We are running mean and lean this morning. Okay, Senator Coleman, whenever you're ready on Senate Bill 458.
Thank you so much, Senator. This is a bill that was filed last year by Senator White, and it's substantively the same, although there's been a number of modifications, and it got right up to the line. There was something that got added, needed to go to conference, and things blew up before it was able to get taken care of. But it is a number of provisional changes that have been brought by the department to make their job easier in protecting our children. I'm happy to go through those, although we are a lean committee, and if there aren't any questions, I'm going to just go ahead and go on the record and say it's the bill summary is pretty self-explanatory.
Any questions? Seeing none? Any witnesses in support?
Good morning again. My name is Mary Chant. I'm the director for the Missouri Coalition for Children. Thank you, Senator Coleman, for putting forward Senate Bill 458. We support a couple specific provisions of that. We appreciate that it does align, much of the new language aligns with the Federal Family First Prevention Services Act language, so the priorities around including families and including support people that youth can invite to be a part of their family decision-making team. We think that is important. We appreciate the priority about building out community-based services to reduce the number of children who need to access residential treatment services. We do like, and we've had a conversation previously, there is one part that has been added that that we think could be amended, and that is it does include that psychiatric residential treatment facilities also fall under the independent assessment review process. We don't believe that that is necessary. It's not necessary under federal law. And in order to access PRTF services, those are Medicaid provided services, there's a high level of review and scrutiny before a child would be able to access those services. And also in the non-foster care population, children who have Medicaid or other third-party payers could also access psychiatric residential treatment facilities. They would not have to go through an additional review process to be screened for that. So we have concerns that children in foster care have an additional hurdle to access a psychiatric a psychiatric treatment service that those not in foster care would not have to be able to do. But the majority of the bill, we very much appreciate its focus, its aim at prevention, and I'm happy to stand for any questions.
Thanks for your testimony. Any questions? Seeing none, next witness in support. Any witnesses in opposition? Seeing none, any witnesses for informational purposes? Seeing none, that concludes the hearing. Senator, any closing remarks?
No, there are a number of the small changes that are going to need to be made with various partners, and so those will be reflected in the Senate committee substitute.
Great. Thank you very much. Do you want to, I was going to, yeah. I'll entertain a motion to adjourn. All in favor? Aye. Any opposed? And we are adjourned.